Have you ever wondered about the intricate connection between hearing loss, dementia, and the various challenges that older adults face in their journey with audiology? Today, my guest is uniquely positioned to answer all of these questions and more. Dr. Rachel Allgor, a Minnesota-based audiologist, started her venture, Journey Audiology and Hearing Care, with the mission to make quality audiology services more accessible. Whether it is at her Hastings, Minnesota clinic or directly at a patient's home, Dr. Allgor is ensuring that every patient feels heard, literally and figuratively. Having experienced hearing loss herself, she empathizes with her patients in ways few can. And it's not just about hearing care. Dr. Rachel is passionate about addressing tinnitus and sound sensitivity and established the Journey Tinnitus Relief Center, making waves in the field. An active member and current president of the Minnesota Academy of Audiology, Dr. Rachel Allgor's dedication to the field and her patients is evident in all she undertakes. In today's episodes, we talk about topics ranging from the crucial link between hearing loss and dementia to the importance of early intervention. Ever wondered about the real story behind tinnitus or the significance of regular ear exams? Or maybe you're interested in the recent advancements in hearing aid technology and its potential benefits in dementia prevention? We've got you covered. And for all of the caregivers and families out there, Dr. Allgor will share invaluable communication strategies to make your interactions a little bit smoother. And as we finish our conversation, we talk about the importance of awareness, advocacy, and the powerful role of collaborating in the audiology realm. This is my interview with Dr. Rachel Allgor. Hi, Rachel. We meet again. We had the opportunity to meet in person, which was so much fun. Thank you for being here. How are you?
I'm good. How about you?
I'm good. It is September in Minnesota. It is actually super chilly, don't you think, comparative to what we've had?
Oh, the weather shift, our standard Minnesota,
Totally.
but it has been a little rough.
I know. I'm like, oh my gosh, I had to find a jacket. I was like, I'm not prepared for this. I think it's gonna warm up, but we're doing what Minnesotans do, which is talk about the weather, which I love
Always.
all
This
the
at least is
time.
good bonfire
Right?
weather.
It is fall, apple season, all the things.
Mhm.
Well, I'm so glad we were introduced to each other by a dear friend of both of ours, Gary Solomonson. And
Mhm.
he brought us together knowing our connection to older adults, education. We both are in the Twin Cities, so we were able to meet in person, which I loved. And in our conversation, learning about what you do, all that you're up to, I thought, oh my gosh, we could have such a great podcast conversation since hearing and hearing loss affect a lot of us and our older adults. So I'm excited to talk about all the things. But first, tell us, how did you get into practicing the field of audiology? Who do you work with? What are your specialties? And yeah, all of it.
Yeah, absolutely. And so I was first introduced to audiology at a very young age. I personally have a hearing loss, and I've had it since childhood. I was lucky enough to have a mom who is also a deaf and hard of hearing teacher. So she was very aware of what to look for and how to advocate for me best. And so I am thankful every day for her for a
Yeah.
multitude of reasons.
Oh,
But with that means that I had surgeries starting at like a year and a half on my ears. And then I had more major ones at like 2.5, where they had to remove a tumor that was benign but not supposed to be there in my middle ear on those three smallest bones of your body, so like the hammer, anvil, stirrup. And with that, wiped out a lot of my hearing.
mm,
And so I had a prosthetic put in, but it didn't really work because I was 2.5 and you have to stay quiet for a month, and that just wasn't going to happen. And so I had another surgery in seventh grade to do the same thing, essentially, which did improve my hearing. Still not enough to go without a hearing aid, though. And so I wore a hearing aid in younger elementary and then again in high school. And so I wore it much more off than on while growing up, if I'm
Mm-hmm.
being honest. And then I started recognizing the importance of it as I was earning my degree in audiology.
Mm-hmm.
And so now it's a daily wear thing. I don't have any issues. I prefer to have it in, which I don't think my younger self would have ever thought would be
Yeah.
the case.
Oh,
And
I'm
so
sure.
that was my introduction to audiology, which is more unique than most. And so I've worked in private practices primarily, and I actually just started my own recently called Journey Audiology and Hearing Care. And so I'm very excited about it and just excited to help people in a different way.
Yeah. It's a personal, it really is. And you have that experience of your own story and then coming into how you know you can support other people. So, yeah, I'm
Exactly.
glad it brought you here. As you were talking about wearing the hearing aids more not, right, than than often when you were
Hmm.
younger, I was interviewing this dementia prevention. He wrote a book, Dementia Prevention. He's a neuropsychologist, Mitchell Klinowski. But he was saying that don't treat your hearing aids like the crown jewel in that you only pull them out for special occasions. He was
Hmm.
like, wear them all the time, you know? And we're going to dive into that. But as you were sharing that, I think that's what can happen, right? We're like, oh, well, I'll just use them periodically. And especially as a teenager, too, I'm sure it's like
Hmm.
there's a lot that goes on with that. Yeah.
Yep. There's a lot of emotion in it
Mm-hmm.
too.
Mm-hmm.
And so there's a lot of things with hearing loss, and especially with wearing it full time, there's a host of reasons.
Yeah.
Why? The thing that I typically will say to patients is that if you're in this hard situation and you're wearing the devices, your brain is suddenly getting all of this information that it doesn't know what to do with. If you're wearing it all the time, then your brain already knows, like, oh, that's just a fan noise. I don't need to pay attention to that. Oh, that's people talking over there. Not important. I don't need to pay attention to that. And it can learn how to filter things a lot better so
Mm,
that you actually perform better in those harder situations when your brain already knows what the sounds are.
yeah. Oh, that's such a good explanation. Well, and if we're looking at how does age-related hearing loss differ from other types of hearing impairment?
And so, I mean, like me, I have what's called a conductive hearing loss. And so for me, the cochlea or the actual hearing organ in your ear
Mm-hmm.
isn't damaged. I just need help getting the sound to it because those bones that are supposed to transmit the information don't vibrate anymore because they don't exist. And so for that one, people generally just need things louder. And then once it gets to the organ, the cochlea, it doesn't have any problems processing it. For an age-related hearing loss, it's typically a breakdown happening in the cochlea itself, where there are 15,000 little tiny hair cells in there when you're born. And throughout a lifetime, those start to die off, whether that's just from age, whether it's genetics, whether you've had medications that have damaged it, whether you've been exposed to a lot of noise that has damaged it. There's a number of reasons that can cause it. But when you start losing those hair cells, it gets harder and harder for the brain to interpret the information coming to it because you just don't have as much information there. And so instead of an issue of loudness, it's typically an issue of clarity.
Mm,
So people know when others are talking, but they don't know what they're saying anymore. Or it's hard to figure out, like, oh, I don't know what that word was. And then the conversation keeps going, and you're still trying to figure out that word. And so you miss everything else that just
mm-hmm.
happened. That's typically what's happening with an age
Okay.
related one, where you lose more of those high frequencies that give clarity.
I like that distinction. We can see that clarity versus the loudness.
Hmm.
Yeah. How for families if they're have loved ones in their life what are some of those early signs of hearing loss that we could maybe be aware of, or like what do we look for?
Sure, often it's not going to be on one-on-one situations. One-on-one, a lot of people will do okay, or there's enough compensatory strategies happening, or a lack of distractions, where they're able to piece all the information together.
Hmm.
You're going to see the breakdowns first in busier environments. So, whether it's a larger family gathering, or a restaurant, or even in the car, where the family members are going to notice that they're just not picking up as much anymore, or they're asking for more repetitions, or they stop engaging in the conversation altogether. And I know that's what happened with family members of mine, where we would put my great grandmother at the head of the table so that she was able to see more of what was going on. But it was really hard for her to engage in the conversation happening because there was just too much noise.
Right, right. And she wasn't in the middle of that. There have been a lot of studies coming out recently about the link between untreated hearing loss and the increase of dementia. Share
Yes.
with us some of the science behind this connection and what we're learning about it all.
Sure. And so most recently, so I think it was July, mid-July of this year, so 2023, that an ACHIEVE study came out. And so that stands for Aging and Cognitive Health Education or Evaluation in
Mm-hmm.
Elders. So it's an acronym.
Mm-hmm.
And it was a 3-year like longitudinal study where they had two groups. One group had like health education given to them, and the other group had hearing aids fit on them. So each group had some amount of hearing loss. There was a subgroup within that had heart related issues that gave them an increased risk factor of cognitive decline.
Mm.
And so it was in that subgroup where they saw this huge number. It was 48%, so nearly half
Wow.
had a reduction, or the effect of wearing the hearing aids produced a
Mm.
50% reduction in cognitive decline,
Wow.
which is just this tremendous number that
Mm-hmm.
we haven't seen as much of in previous studies. There's been other studies previously that said like intervention in midlife of hearing loss can reduce the risk by 7 to 10%, I believe,
Mm-hmm.
cognitive decline, which that was the largest number that was present at that
Yeah.
time. And so to get this new study that's saying
Wow.
48%, it's just astronomical.
It is.
And so it was specifically for this subgroup that already had additional risk factors for
Mm.
cognitive decline. When they looked at the
Interesting.
two groups side by side without like factoring in just the subgroup,
Mm-hmm.
it was even. Like
Okay.
there was an even decline of cognitive abilities.
Okay. So fascinating. And is there data or how crucial it is for the early intervention in hearing loss? Like, does our brain rewire itself when we're dealing with those losses? How does that work out in our brain health?
So the earlier the better. And I think that's for most
Yeah,
things
most
in
things in
life.
life, right?
Mhm. For hearing, the reason why we say that earlier is better is because a lot of times when you accrue damage and accrue like cognitive decline, it's harder to pull back from that.
Hmm.
It's easier to do prevention than it is treatment. And again, that's true for most things in the medical world.
Right.
And so what's happening in your brain is that there's specific areas that are attuned to auditory input. When you have hearing loss, you lose that input to those areas. And when the brain doesn't receive information, it likes to rewire itself. It'll reorganize things to use pathways for something else that is more usable at that time. When that happens, we start losing the ability to understand and hear clearly. And if that gets to a point, it's really hard to come back from. And so when I'm doing testing, I'm always checking to see, okay, how many words are you getting correct right now when I know it's loud enough? If that number starts dropping, I get more concerned because I want to know what's going on. Why is this happening? And if it's dropping and you're not using any kind of hearing help, it's like, okay, here's something that we know can slow down that progression.
Right.
Can I stop it? No. But can I slow it down? Yes.
Yes.
And
There's a
so the
little
more
bit
we
of hope.
use those pathways, the stronger they become, and they stay as auditory ones instead of getting switched to something else.
Okay. So good to know that. And when you talk about, right, okay, so early prevention, right? Prevention is far the greatest
Mhm.
tool we have. There are barriers, I think, when we're seeking treatment. I know there was family members in my life and they weren't really sure where to go. I mean, I think they knew audiology, but they weren't sure about how to access maybe the best care. What are some of those main barriers that older adults face when they're trying to seek that treatment? And what's a good place to start? Do we get a baseline test? I know you and I talked about like, okay, when we go to the eye doctor, right? It's just standard. You go every year,
Mhm.
but we don't really think about, I mean, if I'm being honest, I don't know if I've been to an audiologist in like years. Yeah.
That's a very common thing for me to
Mm-hmm.
hear, even for 60-year-olds to come in and say that they've never had a hearing test before
Mm-hmm.
is really common. And so, as for the barriers to access, one of the most common ones is that those with Medicare have to have a doctor's order
Mm,
to have a hearing test. So they have to first see their primary care or talk to their primary care at the very least in order to get a doctor's order simply to get the diagnostic hearing test done. And so that right now is a barrier that we're trying to address with legislation and getting
mm,
rid of that so
mm-hmm.
that patients can just come to us and know that it's going to be covered.
Right.
And so once we get rid of that barrier, the next one is usually going to be a price issue where people think hearing aids are going to cost this extravagant amount of money. And they can be expensive, but there are a lot of options available. And so we're going to be able to find a solution that works
Mm-hmm.
for everyone.
Mm-hmm.
It's just a matter of what is needed and what's the budget. Any audiologist can work with that and figure out a solution that's going to work best for each individual person. And so I think it's just scary.
Yeah.
Eyesight is now a fashion, like glasses are a fashion statement
Mm.
now, where I don't know what the eye doctors did, but they were able to
That
make it
movement worked. Yeah.
into instead of a stigma
Right.
where it's like, ooh, even if I don't have any vision issues, I'm gonna wear these glasses
Yeah.
because
'Cause
they
they
look
look good.
cool.
Yeah.
Hearing aids
Are
have not gotten there.
Yeah, yeah. Do you ever see them becoming more of a fashion statement? I mean, has someone been
We
bold
have
enough
seen
to
it.
create
We
something?
have seen this happen
Mm-hmm.
because there are hearables
Mm,
now, or like the Bose headphones and different Bluetooth devices
mm,
that simply sit in your ear. And so it's becoming a lot more common
right.
to see some kind of ear gadget
Yeah.
going on.
Yeah.
And there are some hearing aid manufacturers that have made their in the ear hearing aid look a lot more techy. And
Mm-hmm.
so it looks like a Bluetooth device instead of like a hearing aid
Yeah. Yeah.
because there's all of this emotional baggage
Mm-hmm.
typically that'll
Mm-hmm.
come with needing to wear a hearing aid
Yeah.
where it can make people feel old.
Right. Right. Isn't that interesting, that stigma with hearing loss and feeling older? It's like, how
They
did
are
that
very
start? How
tied
does that
together in our
happen?
culture.
Yeah, they are. They are.
What I find more interesting is that, like I mentioned, price is a barrier.
Mm-hmm.
There are several countries around the world that include hearing aids in their like national health organizations.
Mm-hmm.
Even when hearing aids are free, the people wearing hearing aids that need them is still 30 to 40%.
Interesting. Wow.
In the
Why do we
US,
think
we're
that
at like
is?
25, maybe
Oh
30%.
my goodness.
So the difference between the two really isn't there.
Mm-hmm.
And so, while yes, price is a big issue,
Mm-hmm.
we know it's not the main issue
Yeah.
because otherwise more people would be using it when it's free.
Right. Right. It is that stigma, I bet, if I'm
Mhm.
hypothesizing.
That
Oh,
is the current trend.
yeah. Yeah. Oh, it's unfortunate. So I had brought up, just as we have regular eye exams and they're viewed more as fashion in some of the ways that they've positioned eyeglasses, should we be having regular ear exams? And if so, like how often? Why is that important?
That's a great question. I would love if people would start getting regular hearing checks. Personally, I think getting a baseline around age 55 is a really good idea. So it doesn't mean that you have to start doing annual hearing tests at that point. It just
Hmm.
means let's get a baseline to see where things are at right now
Yeah.
so that we have something to compare against in the future if things do change. Because one of the main things that I look at is how fast is it changing? If there's no prior information, we have no idea how long that hearing loss has been there and
Mm.
how quickly we need to move on any kind of treatment. And so once we establish that a hearing loss is present, we should be getting a hearing test every year just to make sure that there isn't any changes. If you're wearing a hearing aid or two, then definitely every year because they're digital. We
Right.
can modify these really easily to adjust for any issues that keep cropping up as we age. And so any kind of regular check is
Yeah.
going to be a good idea, especially if there's a sudden loss
Mm.
or sudden balance issue, sudden tinnitus issue.
Mm-hmm. Mm-hmm.
Go in sooner
Mm-hmm.
and get it evaluated as quickly as you can. Because we know that with any kind of sudden loss, the interventions for it need to be sooner than later.
Yeah, happen more immediately. So
Hmm.
you brought up tinnitus,
Yeah.
and some of us pronounce that as, I think earlier it was like tinnitus, but that's not always correct, or people might use both. Share the difference between the pronunciations, but also it's not a form of hearing loss, but a symptom of an auditory system breakdown. How does that relate to hearing loss? Because I know it can be a huge frustration for people.
Oh, it definitely can. So, on the name itself, tinnitus and tinnitus are both correct pronunciations. Personally, I pronounce it tinnitus because an itis, as a suffix in the medical world, is an inflammation.
Mm.
And we know that's not what's happening with tinnitus. And so I
Hmm.
just pronounce it the other way
Yeah,
to keep it straight in my own head.
right, right. That makes sense. It's like the name. I love the root cause, the root descriptions of names, and then you're like, oh
Hmm.
yeah, you can go back.
Yep. And so
Hmm.
tinir is where it comes from. It means to ring.
Mm.
And so tinnitus, if you don't know, is ringing or any other noise in your head or ears. And so it can be a ringing, chirping, chiming, buzzing, hissing, even music and different like
Interesting.
auditory hallucinations
Wow.
in there can occur. And it can be tremendously bothersome to individuals. And it can pull concentration. It can impact quality of life and the ability to sleep. And so it can make this huge effect in people's lives. I actually have a large passion for tinnitus, and it's one of my specialties, along with sound sensitivity
Yeah.
treatments, both for specific sounds and like sound loudness
Hmm.
tolerance issues. Uh, but with tinnitus itself, what's happening is that there's damage somewhere in your auditory system, typically within the cochlea. And like I was explaining earlier, the brain likes to get consistent information. from the ear. When there's damage, that consistency gets interrupted. Whether that damage is enough to cause a hearing loss or not, it's still an interrupted message.
Mhm.
So the tinnitus can occur in anyone who has any amount of damage in the cochlea. So I have treated several patients that have perfectly normal hearing,
Wow.
but have a debilitating tinnitus. And I've also treated patients with tremendous hearing loss, a profound hearing loss, but no tinnitus.
That's
And so
something,
it's not always a predictor.
right?
Of, like having hearing loss does not necessarily lead to having ringing in the ears,
Mhm.
but there are higher correlations
Okay.
of that.
How do you treat for something like that? Is there hope for people that they can have that treated effectively? Is it something we have
Yes.
to live with? Okay, there's hope. Good.
So there's definitely different treatment
Hmm.
options, and more are coming out now. Generally, it's going to be some kind of sound therapy, whether that's a constant noise or whether it's something that you listen to for a certain amount of time each day. I've used both different methods, and both can be very effective. And so, again, it's really figuring out what's going to be best for each individual person
Yeah.
and what they're dealing with.
It's
And so,
so, yeah.
yes, there's a lot of hope. I promise there's a lot of hope.
Good.
It's just a matter of figuring out what's going to be best for each person. And
Is,
that it can be done with any hearing healthcare provider,
yeah,
particularly ones with a tinnitus specialty.
specialty. Okay. And is it related to age or older adults, or is it any age?
Because hearing loss is more common in older adults. I
Hmm.
think the last thing I read is that 65% of adults over the age of 60 have some amount of hearing loss.
Mm.
And so there's just a higher prevalence of hearing loss in older adults. And so I
Hmm.
see more older adults.
Right.
For bothersome tinnitus, that'll happen at any age.
Okay.
I've had as young as an 8-year-old and
Wow.
as old as an 88-year-old.
Yeah. It's all over, all the different ages. So, for families and caregivers, communicating with someone that has hearing loss can be frustrating at times. Do you have any recommendations or strategies to ease this frustration, or things we should think about as a family member about what our loved one must be experiencing emotionally or, psychological effects from that?
I have so many.
Good.
So, two primary ones that I generally recommend to anybody with hearing loss and their caregivers or family members is that it's a dual responsibility. It's not all on the person with the hearing loss, it's
Mhm.
not all on the family members or caregivers. And so the responsibility of the person with the hearing loss is if you missed something, repeat back what you did hear.
Mm.
Instead of just saying what or huh, that puts all of it onto the other person to repeat back whatever they just said, which gets frustrating a lot faster when you have to repeat back multiple times,
Mhm.
especially because you keep using a specific word that the person with hearing loss just cannot hear or doesn't understand. And so instead, what you can do is repeat back all of the parts that you did hear and ask for clarification on those one or two things that you missed.
Mm.
And so that is a lifesaver for me personally,
Oh, I'm sure. Eases a
as
lot
well
of
as for patients.
frustration. Yeah. Yes.
Mhm. Because then you can also see that each of you is trying.
Mm.
Because I think a lot of times for caregivers and family members, it feels like saying what is just this default response. And so they get exasperated, they get frustrated, or they give up entirely
Hmm.
and stop trying.
Yeah.
And so then on the flip side, for the family member or caregiver, get their attention first.
Mm.
Make sure that you're saying their name or something to make sure that they know that they need to be listening. Otherwise, it's going to be a lot more common that they miss the first half of whatever you're trying to say
Right.
because they don't know they're supposed to be listening.
Yeah.
And try to be in the same room, try to be facing them. It's a common complaint that a spouse can't hear their partner when their head is buried in the pantry.
Yeah.
Like, yes, you're right. That is a difficult listening
Right.
environment. Let's try to turn around and talk directly to each
Hmm.
other.
Exactly. Exactly. For all of us, right? Yeah.
Or you're at the stove and the fan is on and you have the TV going in the other room. That creates a really difficult listening environment.
Mm.
And so, best thing is make sure that you have their attention and try to be in the same room facing each other. If you have good lighting, even better, because regardless of what anyone says,
Yeah.
everyone does speech reading. And so speech reading isn't just looking at lips, it's
Right.
looking at your whole face. Because in the English language, questions, like our inflections will go up, our eyebrows go up,
Yes.
like we're reading the whole face to understand what's being communicated to us.
Hmm. Hmm.
And when you have a hearing loss, you automatically do this. I remember in middle school having to teach myself to look at people's eyes instead of their mouth because
Interesting.
I was like, oh, people are getting weirded out by this.
Yeah.
Okay, let's see what I can do.
Exactly. And I'm sure you could read so much in their eyes too, just like you explained our expression and eyebrow raise and yeah.
Mhm.
Oh,
Yeah, and so those are like the two biggest things
yeah.
that we can do to help somebody with the hearing loss. Say
That's
their name
helpful.
first, be in the same room.
Hmm. That is so helpful. And I think we would think of that as being more common, but it is such a good reminder because we get life is busy, we're going about our schedules, and we forget those simple things that we need to be doing to make it easier. Yeah.
Hmm.
Yeah. There's
Exactly.
so much advancement in technology. We've come so far with the hearing aid
Hmm.
technology. I'm just so curious about what you're seeing, how that tech is advanced, what we can be hopeful about for the future. I know I was visiting with my father-in-law who recently got hearing aids, and I honestly just must have been out of touch, right? Clearly, I haven't been to the audiologist. But he pulled up his phone and it was an app on his phone, and he could pick on the app if he was speaking one on one, if he was in a restaurant, if he was in a crowded room. And it just like blew my mind. The level of options for that. I was like, okay, this is so cool. We've come so far clearly from since when I've interacted with them.
Even in the last 10 years, technology has advanced tremendously. It is unreal how much farther we've been able to go and
Mhm.
how much smaller we've been able to get the devices. I remember as a kid, the hearing aid was the full size of my ear,
Wow.
and it was like a big beige banana, is
Yep.
what I called it.
Yep.
Because that's what it looked like behind your ear.
Hmm.
Not attractive. Like, when I was really little, I had like an antenna coming out of it too, because it had to connect to the teacher's
Oh, yes.
microphone for it. And the technology advancements that have happened are just so much fun to deal
Mm.
with. Because, yes, there's the Bluetooth streaming compatibility. And so your phone can become your remote. You can choose like what kind of setting you're in. The hearing aids are generally smart enough now to know what kind of environment you're in and automatically adjust.
Wow.
So you don't even have to do anything.
Hmm.
And they're able to do that at a better rate than what we can do manually, is what the research shows.
Okay.
Is that the hearing aids are better at picking what
Yeah,
you're in
they're
than you are.
smarter. Yeah. They're like, we got it.
And then you can stream phone calls. You can stream music. Like whatever is on your phone can get put directly into your ears at a correction for your hearing loss.
Amazing.
And so it's just so much fun. I call it fluff.
Yeah.
So hearing aids are meant for the hearing help.
Right.
And all of the stuff with the phone is fluff. It's very convenient fluff. And
Hmm.
it's fluff that I use every single day,
Yeah.
all day long.
Yeah.
And so it makes having to wear devices,
Mhm.
more of a getting to wear devices.
Yeah. Yeah.
So I get to wear this, and I'm able to stream a TV show while I'm doing something else, like
Mhm.
doing the dishes,
Mhm.
making dinner, or I can listen to music. I can have a whole phone conversation through it, and it's just going directly into my ear.
Yeah. It's
And so it's
incredible.
been a lot of fun with that, and more advancements are coming out each and every year. And so with AI things,
Mm.
we're able to do a lot more, and the functionality that exists between the hearing aids and phones, even for like fitness tracking,
Wow.
they're able to do that and do step counts. So
So
it's been
much.
really fun to
Yeah.
see what's happened, and I'm excited to see what comes next.
Oh, I bet. I bet. There's the importance too, I think, of even the awareness of letting people know all of these options. Are you finding that there are ways we can do that? Or how do you suggest this movement, the more momentum of preventative and annual and just awareness around audio health?
That's a great question, and something that we are trying to address on
Mm-hmm.
so many different levels. I think the first step is just going to be more brand awareness, if you can
Mm-hmm.
say that, for
Okay.
audiology
Right.
in general, and have it be a known thing.
Mm-hmm.
Because I tell people what I do, and they're like, I don't know what that is. It's
Yeah.
like, okay, here, let me tell you. Uh, And so I think that's going to start from a much younger age. And so having audiologists go into schools and
Mm.
explain like, why we need to use hearing protection. Because, like everything else, prevention is key.
Right.
I'd much rather fit somebody with hearing protection than hearing aids. And so if we can start it young with just at least a basic awareness of when to use hearing protection and why it's important,
Mm-hmm.
then we can start getting a little bit more traction and momentum towards, okay, what can we do about just having people know who to go to when they're having this issue? Because I'm sure that's a Google search that pops up often.
Yeah.
I think I have a hearing loss. What do I do?
Mm-hmm. Mm-hmm. Where do I go?
So
Yeah.
it's knowing which specialty to address. So ENTs, or ear, nose, and throat
Mm-hmm.
physicians, are often the gateway into everything else with audiology.
Okay.
And so it's creating a really strong and healthy partnership with those
Mm-hmm.
physicians and with
Mm-hmm.
general practice ones to make sure that appropriate referrals are happening as soon as something is mentioned instead of waiting and waiting and waiting. I think the average length of time between somebody noticing a hearing loss and actually coming in for help is 7 years.
Oh my gosh. That is
It's
way
a really
too
long time
long.
to be
That's such a
struggling.
long time. Yes. Unnecessarily struggling. Yeah.
Mhm.
Yeah.
And so if we can shorten that at all, and
Mm-hmm.
some of that is coming with over-the-counter hearing aids. And I think that's been a really big thing in the last year, where more people are becoming aware of hearing aids and hearing health
Mm-hmm.
because it's become a little bit more accessible
Yeah.
that way. You don't have to go to a provider. And so there's a host of things with
Oh,
that as
I'm
well.
sure. So, how does that work? Does someone receive or purchase a hearing aid that is, because I'm not the audiologist, but that is a general elevator of sound and they can utilize it that way? Because I'm curious how you would find the right one if you haven't been tested on your
That is
hearing.
the trick.
Yeah.
And so within like all of the over-the-counter ones, or
Mm-hmm.
OTC hearing
Mm-hmm.
aids, use an app.
Okay.
And so they perform a hearing test with the hearing aids in.
Got it.
In my mind, that's provided that they're in appropriately and they're fitting correctly and even just pushed in all the way.
Right.
And so
Like
there's a
user
lot of
user
different
error.
factors to
Yeah.
go into there.
Yes.
But I know that people can receive a lot of help with
Mm-hmm.
that, and
Mm-hmm.
just getting their foot in the door
Right.
at a lower price point generally,
Mm-hmm.
too.
Mm-hmm.
And so whatever helps people get more access to hearing in the hearing healthcare world, great.
Yeah.
I am for it.
Yeah.
And then once they realize they need more from it, they'll find me.
Good. I hope so. I hope so. You answered my question as I was like, how do you collaborate with those other healthcare professionals? So it sounds like primary care, ENT, any other healthcare professionals that you find that you collaborate and work with?
Psychologists,
Mm.
or especially within the world of the tinnitus stuff,
Mm-hmm.
I was referring practically every person for some kind of psychology help.
Wow.
And that's mainly just to gain more skills
Mm-hmm.
surrounding it and knowing what
Mm-hmm.
to do in the moment. Because a lot of the treatment options we have are for the marathon, not the sprint.
Yeah.
And the psychologists and psychiatrists are there to help in the sprints, in the moment of what to do when you're just feeling overwhelmed.
Yeah.
I don't have that training. I know that others are
Oh,
far better equipped
yes.
to
I
help more
love
in
that
those
you make that
situations.
recommendation. What an important recommendation. Yeah, it's that
Mhm.
really, truly that holistic approach to it all. It
Exactly.
is.
And as
Yeah.
we learn more and more about the cognitive health with hearing health,
Mm-hmm.
I think we're gonna find more referral
Mm.
kind of pathways towards neurology too,
Yeah.
and figuring out, okay, when do we need to really refer for these
Mm-hmm.
full-blown cognitive assessments?
That makes sense. That makes sense. Well, I'm hopeful. And there are different ways we can have resources. Do you have favorite recommendations that you give to people about just education on hearing loss or hearing health that you like to send people to get more tools and information?
My favorite thing for like noise prevention is going to be
Okay.
dangerousdecibels.org. Pretty sure that's a .org. And they have a lot of different resources available there
Mm,
uh, to know like how loud is too loud. Like at what point do I need to be wearing hearing protection?
yeah.
There are also different sound level meter apps that you can download
Oh,
to
like
help
when
with
you're in
that
a
too.
place, you can be like, this is how loud it is. Oh, that's so cool.
Oh, I am
Is
the
that?
nerd that pulls it out all the time, trying to
Oh,
figure out like, ooh, nope, too
right.
loud,
Do I
too
need
loud.
protection? Yeah.
Or if I was at church
Mm-hmm.
during like the youth services, I would
Mm-hmm.
measure it and then I would just go in the back and be like, nope, you got to turn it down
Yeah. Good. Good.
because it's too
You're
loud.
looking out for all of
Um,
us. Yeah.
and so
Oh.
that's one of my favorite ones there. Um, there is the Hearing Loss Association of America, HLAA, and they have chapters all over the nation and have some really tremendous support materials there. Uh, and so that would probably be my next go-to
Yeah.
of where can we find information um, if you have the hearing loss.
Mm-hmm.
And then let's see. So I'm also currently the president of Minnesota Academy of Audiology, and I know that our website has different resources as well
Good.
um, for at least Minnesota-based
Right.
people. The American Academy of Audiology will have resources as well. And so,
All sorts of
yeah,
good
those are
places
my
to
primary
go.
ones
Yeah,
probably.
place to go. Good start. And with, beyond hearing aids and medical intervention, do you have any, I don't know, tips on just health in general? I know it's also right not being in those super loud environments, but any like holistic therapies or things that you like to incorporate or tell people about?
Mindfulness is going to
Mm-hmm.
be like kind of the biggest thing, especially
Mm-hmm.
for the tinnitus side. A lot of times for people with a hearing loss, it's a grieving
Mm.
process.
Yeah.
Like more than anything else, you're grieving the loss of whether it's your perception of youth or it's just the ability to understand those around you. It's a grieving period.
Yeah.
And we know that it isn't linear. Like you bounce around and you
Mm-hmm.
deal with the same things multiple times. And I've been through that even now.
Yeah.
Uh, I'll have periods where it's like, I just want to be able to hear.
Right.
And I know it's not possible physically, and I know I'm doing everything possible to fix it, but it's still that frustration present.
Yeah.
And so, whatever you can do to help with that,
Mhm.
and understand that it's okay. It's okay to be frustrated. It's okay to have those days, but get the help when you need it is the important piece
Yeah, and
too.
that support. Thank you for sharing that. I think that's an important piece of it. And for people that want to learn more about you and connect with you and possibly come see you, where can we direct them?
Absolutely. So my website is journeyaudiology.com. My email is dr.allgor@journeyaudiology.com. And so feel free to reach out, even if you just have questions on different things. I am more than happy to answer that. Um, it, it's this whole world of unknown for most people,
Yeah.
and the unknown is scary.
Yes.
I am, I want to make things less scary.
Oh,
I know it doesn't need to be scary, and I know that hearing aids just help.
yeah.
They're not gonna fix things, but they make life easier.
Yeah.
I'm all about making life easier.
Right.
It's hard enough as it is.
I know. Oh, we need your encouragement. Thank you. It's been a joy. I learned even more today than I did before. So, thank you for your time and your expertise and making this conversation so accessible and interesting for us to listen to. So, I appreciate it.
Well, thank you for hosting and finding people like me to have on here to share things and just get more knowledge
Right.
out into the world. Knowledge is power.
It
Let's spread the
is.
power.
It is. Exactly. Exactly. Thank you so much. Thank you for listening today. If you enjoyed our episode, please subscribe and give us 5 stars. In all honesty, we'd love to hear from you. Thank you so much for listening to our episode.